Good afternoon, ladies and gentlemen, and good evening to all participants in Afghanistan. So I'm pleased to welcome you to our event, COVID-19 in Afghanistan, Impact and Opportunities for Support. My name is Michael Fanissadeh, and I'm project coordinator at the VIDC, the Vienna Institute for International Dialogue and Cooperation, responsible for the topic migration and development, and with a regional focus on the Middle East. I also welcome all of our speakers today, who will be introduced later by our moderators. Thank you very much for participating in this important talk. Just brief on the VIDC. The VIDC is a civil society organization based in Austria, in Vienna. The Institute looks back at a long history. It was founded in 1962 from prominent politicians of Austria and the so-called Third World. It is a think tank for global development issues and international dialogue. Since 2015, we have focused on the political development in Afghanistan. The background is the enormous increase in the number of Afghan refugees in Austria, which used to be a small community in the country and since 2015. Today, more than 50,000 people with an Afghan background live in Austria, and Afghans have become the 10th largest immigrant group in our country. As the group in Afghans in Austria and Europe is growing, more and more Afghan diaspora associations are becoming active. Making these diaspora initiatives visible and promoting them is a central importance to the VIDC. Therefore, the VIDC has prepared a guide presenting promising development projects implemented by Afghan diaspora organizations in Europe since the Taliban were ousted from power in 2001. The guide also presents recommendations from the network conference Knowledge Transfer and Support, which took place in Vienna on the 2nd and 3rd December last year. You will find the guide and recommendations on our website, www.vidc.org. The Danish Refugee Council and the VIDC organized today's event to strengthen the exchange between us in Europe and you in Afghanistan. Even though we are only civil society and not donor organizations, we can help to advance the idea of humanity and solidarity, because we know that Afghanistan is facing major challenges and the pandemic is making these challenges even more critical. We know that Afghan health workers face numerous challenges in fighting the virus due to a weak health system, poor water and sanitation infrastructure, and the ongoing armed conflict, not to mention the economic impact of this corona pandemic. In Europe, many Afghan diaspora organizations have therefore increased their support to Afghanistan, and we are very thankful for these initiatives. Thank you for your engagement. I would like to take the opportunity to thank also the Danish Refugee Council for the good cooperation in planning today's event. And I want to thank my colleague, Dr. Ali Ahmad, who was instrumental in planning the program with us. My thanks goes also to the founders of today's conference, the Austrian Development Agency and the Ministry of Foreign Affairs of Denmark. I would now like to move on and give the floor to my colleague, Mingo Hajduk. Mingo is head of unit at the Danish Refugees Council's Diaspora Global Program. Mingo, please, the floor is yours.
Thanks, Michael. Hello, everyone, and Mohammadi to our second joint event. It's actually quite a pleasure to see so many of you again. I think a lot of you also participated in last year's conference we co-hosted with VIDC, or we contributed to it, VIDC, and also the event we hosted in Copenhagen to facilitate diaspora dialogue. So really good to see so many of you again. As Michael said, my name is Mingo. I'm heading what's called the Civil Society Engagement Unit at the Danish Refugee Council. And the unit also includes what is called the Diaspora Program. Maybe very briefly on the Danish Refugee Council, it's a humanitarian, non-governmental organization. Focus on supporting dignified life for refugees across the world and displaced people across the world. Majority of our work is actually direct implementation of humanitarian aid and development assistance in approximately 35 countries. Among these is Afghanistan. And DRC also has a strong focus on facilitating the role of the civil society in supporting dignified lives of displaced people and refugees and here under transnational civil society diaspora. This has been done in DRC since 2010 via what most of us know as the diaspora program, which is part of this unit, where we since 2010 have been engaged directly with a number of diaspora actors to facilitate their constructive engagement in countries of origin towards supporting affected populations affected by displacement and conflict. The majority of our work has been with the Afghan, Somali, and Syrian diasporas. We're working with others as well, but these have been the core countries. And Afghanistan being one of the eldest collaboration diasporas that we have that were part of even the pilot engagement DRC had and started in 2010. The work we do is a mix of collecting evidence, doing research and knowledge production on how diaspora engages and what the added value of diaspora engagement is, etc. It's also linked to policy and advocacy, amplifying the voice of diaspora as part of civil society, supporting advocacy efforts and policy development in regard to the role of diaspora. But it's also quite operational programming and operational support. Maybe to mention the specific engagement we have with the Afghan diaspora is a project called Diaspora Project Support, where we have a national funding mechanism providing technical and financial support to Afghan diaspora associations in Denmark. And we're also currently running a project focused on Afghan diaspora information provision, focusing on how the key role that diaspora plays in providing information to refugees and migrants, both before, during, and after their journey, to support migrants and refugees and enable them to protect themselves better while en route. And that works with specific partner organizations in Germany, Denmark, and Netherlands among the Afghan diaspora there. And then obviously we also have this collaboration with the VIDC and also the broader support to diaspora dialogue in Europe, where among others we had the conference last year, and we've been doing a mapping of diaspora civil society across Afghan diaspora across Europe and their engagement in countries of origin. Maybe also just to mention, since this event is focusing on the terrible situation of COVID-19, especially in countries that have less functioning or almost not functioning health systems, maybe also mention the specific projects or the specific activities we chose to engage in to support Afghan diaspora, opportunities to engage in the pandemic. Project I mentioned on protection information has chosen to change some of its activities to support Afghan diaspora organizations in Germany, Netherlands, and Denmark to raise awareness on COVID-19. Again, a focus on diasporas as information providers, a very core activity, providing relevant and timely information, and from our end to provide training and support to the design and development of communication activities on the prevention, risk perception, best practices, etc., with regard to COVID-19 for diaspora organizations in Europe. And the other one is that our grant mechanism has opened an emergency funding mechanism providing small-scale funding. It's up to 7,500 euro for Danish Afghan associations to conduct localized projects aiming at addressing the primary and secondary effects of COVID-19. So we're trying quite actively within our project portfolio to actually support Afghan diaspora engagement in mitigating the effects of COVID-19. So we're very happy that we were able to adapt our programming in that direction. I'm really looking forward to today's discussion on this topic. All our work in Danish Refugee Council and Diaspora Program is based on a very strong conviction and obvious key role that diaspora plays in most emergencies and in development challenges, etc. So diaspora playing a core role in many of this kind of situation, whether it's through the information provision, but also through direct first line support to responders on the ground, etc. So we're very much looking forward to the discussion and to this opportunity to, as Michael also alluded to, have a discussion that doesn't just stay within the diaspora in Europe, but that also engages discussion with Afghans in Afghanistan, because that link to the realities on the ground is key for diaspora to deliver the best support they can. So I'm very much looking forward to that. I'm also looking forward to hear the specific panels, and the time is short and we already spent some of it. So let me jump straight to introducing Ali Ahmed. Most of you know him, and Michael also introduced him already, from Danube University in Krems, but also associated with the VIDC. And he will actually be chairing the first panel of today under the title of the current challenges in relation to COVID-19 in Afghanistan. And with that, I would hand over to you, Ali. Thank you so much, everyone, for being here. I'm looking forward to keeping up the conversation.
Thank you very much, Mingo and Michael, for your insightful opening remarks. And thank you, Mingo, specifically for your kind introduction. Yeah, this, and I would like to thank on my behalf on, DRC and VIDC for organizing this timely event. It's really great. As you all know, that Afghanistan is facing multiple challenges, and millions of Afghans have already faced food insecurity due to decades of armed conflict, but COVID-19, it leaves Afghanistan on the brink of a humanitarian disaster. I would like to, before I show you a map, I would like to introduce my three main speakers in this panel. And I would like to ask the participants if they could mute themselves, so in case there is a background noise, so it doesn't disturb the speakers. And those who don't need to, they're free to switch off their camera as well, just to improve the connection. I'll be very, as a moderator of the session, I'll be with timing. So I'll ask the speakers to be short and concise, up to 10 minutes, and then we will leave the second part of the first session for questions. And I will ask the participants to leave your questions in Dari, Pashto, or in English in the chat box, and I will refer them to our speakers. So in this panel, Abdullah Mohammadi is currently coordinator for Mixed Migration Center Asia region. He has worked with Danish Refugee Council and the Mixed Migration Center since 2016 and supported the setup of the Mixed Migration Monitoring Mechanism Initiative, which is abbreviated as 4MI, in the Asia region. His background is in demography and migration studies with extensive field experiences in Afghanistan, Iran, India, Sweden, and Germany. His main research interests are forced migration, return migration, and smuggling networks. Abdullah is based in Kabul, Afghanistan. Our other speaker is Suraya Pakzad. She's based in Herat. And we're happy to have her on this session. She's a women's rights activist from Herat. She's founding director of the Voice of Women organization, a nonprofit organization which offers Afghan women and girls accommodation and counseling, as well as supporting them with vocational training and literacy. The Voice of Women organization also runs shelters for women and girls who have been subjected to violence. Ms. Pakzad has received numerous awards for her commitment to the protection of women's rights in Afghanistan. And our third speaker is Dr. Osman Sharifi, a medical doctor, a journalist, a graduate of Kabul Medical University. Mr. Sharifi has spent the last decade working in different Afghan and international media outlets, bringing the story of Afghans to the world. He is presently based in Kabul, working as a text journalist for the French news wire AFP Agence France-Presse. And like most of us, work from home to cover different issues affecting Afghanistan, but in particular the coronavirus crisis in the impoverished country, Afghanistan. To begin our discussion and to, I would like to, I would like to ask Dr. Osman, because you're a journalist, you're a doctor, I want to start with you. How Afghanistan has handled corona pandemic? Could you tell us some realities from the ground? Please unmute yourself, Osman. Please unmute yourself, Osman. We don't hear you.
Yes. Okay, here we are. Well, I want to thank you. It's great to see you, and thank you, everybody. Well, I'd like to begin by saying that COVID-19 pandemic is global, and of course, Afghanistan is no exception. But the case of Afghanistan is a little bit different, and there are reasons for that. First of all, let me say that there's a war raging between the Taliban and the Afghan government. There's mass poverty. The health system is already struggling. On the war, let me just give you some points. Although there's reported to be an undeclared ceasefire over the past couple of weeks, fighting still continues, killing and wounding dozens of soldiers and militants and civilians every day. The coronavirus pandemic is just adding to this misery of the Afghan people, and the number of victims are sadly on the rise. But I have to mention that as per official data, more Afghans have died from violence for the past 3 months since the first case of the virus was detected than from the illness itself, though this could soon change. But let me give you a little bit small background on the arrival of the coronavirus pandemic in Afghanistan, though this other case might also talk about it. The first case was reported in Herat province in late February. He was a returning refugee from Iran. Afghan officials quickly moved to declare an emergency situation, followed by a lockdown of the city. However, they could not stop tens of thousands of Afghan refugees fleeing from Iran, fearing the spread of the virus. But then the question is, what's happening now? Well, let's say the coronavirus is real and it's spread in all 34 provinces of the country. The mortality rate is still low, something between 1% to 2%, but fears remain that more people will be dying because the healthcare system is gradually being overwhelmed. The infection rate, let me just remind that, increased by an astonishing 684% just in May. But since there are still not enough testing kits available, the real number could be way higher. There's a saying in Kabul these days that everybody has the virus. Well, the government attempted to lock down major cities like Kabul, but it failed. There are reasons for that. First, people didn't take it seriously, either due to poverty or disbelief in the seriousness of the illness. When it comes to poverty, just let me remind you that 54% of the Afghan populations were living below the poverty line in 2019, and this rate has likely risen amid this pandemic. There are today hundreds of thousands of daily laborers who depend on daily wage they earn to literally survive. Let's also remember that its impact on the trade of coronavirus has already led to an increase of sometimes 30% in the prices of the food in the past 2 months. So for many, a real lockdown does not seem to be a workable or viable option in Afghanistan, as hundreds of thousands and perhaps millions would starve without working on a daily basis. But then we are nearing the peak of the virus spread in Afghanistan, which is supposed to happen late this month or early next month. And the question is, what can we expect in the future? So in the future, let me say that Afghan health officials are pushing for stricter lockdown measures. The terminology they use these days to describe this pandemic is catastrophic, and that the streets will be filled with bodies if the people do not observe the stricter coronavirus lockdown. Afghanistan's first vice president warned this week that there seems to be options when it comes to two options when it comes to containing the raging pandemic. And I quote him: "We either prepare for the hardship of at least 2 weeks of a strict lockdown and quarantine or mass deaths." However, there's also the strong pushback against this lockdown, with the argument that the existing partial lockdown is already killing whatever business is left in a poverty-stricken country. So sadly, this would mean more cases and more deaths in the future. And violence, unfortunately, continues. The economy is expected to get worse because many industries, let's say like construction, which employs low-skilled laborers, are failing. And in conclusion, let me just tell you that some experts strongly argue that Afghanistan is expected to experience one of its worst years since 2001. I mean, these are the things that I know about, and I'd be glad to take any questions.
Thank you, Dr. Osman, for being very, very, onto the point, and for your some very interesting inputs. But we will come back to you with some questions and some follow-up questions. And I would like to start with now ask Ms. Suraya Pakzad, how does Afghanistan, and particularly Herat, since you're based in Herat, have cope against this pandemic, and probably what challenges do women in Herat face, and how your organization, Voice of Women organization, offer to address these challenges. Please, Ms. Pakzad.
Thank you so much, Dr. Ali, and thank you so much for VIDC for organizing this beautiful opportunity and this conference. In Afghanistan, unfortunately, living normal life remain as a dream for many Afghan people. We are losing lives for a long time in this war-affected land. And unfortunately, COVID-19 is added more and more on the top of that. Osman explained very well where the pandemic started and the challenges which we are facing today. If I talk about Herat province, where actually the first cases found here in Herat because of our close border with Iran, we were facing, and still we are facing, lots of problems due to lack of tests, due to lack of expert and even trained staff. We know all that we are not experienced. We didn't have any lesson learned before. We never had an experience of the Ebola or SARS or other pandemic. So that's why we don't have expert in this regard. And also the poverty, it is unfortunately added a lot on the top of that. When the first case is found here in Herat, and then Herat is quite, went to lockdown, and Kabul, most of flights from, and almost all of flights from Kabul stopped to come to Herat. But because of the poverty, because of the high rate of unemployment, people were not stayed at home, because they thought that they have to choose between starvation and being ill or sick. And they thought maybe they may not die from the virus, but certainly they will die from the hunger, from lack of food, and what they have to provide for their children and for their family. Coming to the part of women challenging during the COVID-19, and of course, in any war, crisis, or any difficult situation, women and children are the most affected group on that kind of scenario. Let me to say that in Afghanistan, gender-based violence does not begin and not that much increased by the COVID-19, but the instability, chaos, and prolonged war is the real cause of that. Women are faced more challenging. However, the main concern, as I said, is not only virus, but so many issues attached with this pandemic is added on the top of their problem, like economical and financial support for their families. And the big concern that those poor women currently have is how to feed their families in the time of lockdown, especially among the most vulnerable, particularly widows. And we are known for the country of widow. And those widows who are, leading household, it is really extremely difficult for them to face the shock of this pandemic with no services and no support. The rate of literacy is in Afghanistan is by 17%, and the majority of those women are jobless. They either working in the field as livestock management and staff, or involved in domestic works in rich people houses. Unfortunately, because of the pandemic, it is totally stopped, and no one let them to go to their homes, where the only sources they had to earn and to feed their family. Unfortunately, during the And they believe that this crisis, that there is no, when there is no social support, even the charity in Afghanistan, we are giving a lots of money out for the poor people, but unfortunately there is no mechanism to give it to the right hand. And so many poor women are, unfortunately, we receive that really terrible and shocking news that they are marry off their young girls, which has resulted to the child marriage because you know, surviving the rest of the family. And also, at the same time, unfortunately, with the lockdown, with the pandemic, the violence against women is also, particularly domestic violence, is nearly doubled, and in some areas it's tripled. So those people are really need support and shelters. But what we can provide to them is, we are really struggling to provide adequate protection for victims of violence and their children. Because with the limited financial and adequate staff that we are working very hard to keep the door of our shelter open for the victim of domestic violence. Although official statistics not available regarding the percentage of the violence against women is rise up, but as far as we receive the phone calls and so many requests for the support, it is shown that it is unfortunately dramatically increased. And also because of the isolation measures and movement restriction during the pandemic, lots of women we received call from them that they are locked down in their areas, and they cannot move because the perpetrators are at home and they are not going anywhere, and there is not regular transportation from their area to come. We are afraid that the number of murders issue will be raised up. And also at the same time as you explained, we are running safe house in the western region of Afghanistan. While our safe house in the region remain open and functional to provide shelter, psychosocial support and legal aid to them, we have lots of difficulties that how we should continue our support. We need to open a kind of quarantine center for the new arrival cases. In the pandemic or any time, we cannot tell them that we are full, we cannot take you in. But we have difficulties. We are looking for extra staff because the working hours is become more, and so many other restrictions and that we have. But it is worth mentioning that while most of urgent cases can be attended to our premises of the safe houses, but still there is lots of women you know, remain behind of the services. Our concern is that women might be in a situation where they are in a great risk, but due to the present situation and the lockdown and isolation, they cannot reach the shelter or they cannot reach safe refuge. And it is no doubt that women will be heavily affected by the socio-economic impacts of the crisis. Poverty, social distance, and lack of access to essential services also added on the top of that. But we try our best, we raise our voices, and we knocked many donor doors to be able to continue our support and have more services and safe houses for the needy women across the region.
Thank you very much, Ms. Pakzad, for your insightful explanation of the situation. You mentioned a lot of topics, actually, and I'm sure there are already a few questions which we will raise later, but you touched upon some very important, like poverty, lack of experts, unemployment, gender-based violence, and so on and so forth, but we will come back to them in our Q&A session. Now I would like to ask Mr. Abdullah Mohammadi, because he's working with Mixed Migration Center. how do you see the situation from someone who works for an international organization? How do you see Afghanistan is coping against COVID-19? Please.
Thank you very much, Ali. You hear me, right?
Yes, I hear you.
Okay, good, because we have many problems with the net connection these days in Afghanistan. Thank you very much, Ali. Hello, everyone. It's a pleasure to be part of this event.
Great, Ali, is okay.
Also, thank you, Dr. Sharifi, for your thorough information on the current situation of COVID-19.
Yes, please take over also.
Okay, I would now. بهتر خواهد شد که بتونی در مورد این مسائل با هم.
Triggered Afghan mass returns from Iran and Pakistan. Iran is one of the global COVID-19 epicenters, and due to the outbreak there, many Afghan migrant workers lost their jobs, which resulted in approximately 250,000 Afghan returning to the country in less than 2 months. Also, thousands of Afghans returned from Pakistan. These returnees are facing unique challenges due to weak health and economic infrastructures in the country, coupled with perceived stigma and discrimination. So, in MMC Asia, we have adapted our returnee survey in Afghanistan to capture the experience of returnees in time of COVID-19. We have started interviewing these returnees since end of March over 7 provinces, as well as 3 border checkpoints of Zaranj, Torkham, and Slamkala. So I would like to mention some of the initial findings from the data we have collected so far. Those returnees we interviewed since end of March have returned from different countries: Iran, Turkey, Pakistan, and some European countries such as Germany, Belgium, and Sweden. Most of these returnees returned after the COVID-19 outbreak, reporting many challenges during their return journeys, including difficulty in crossing borders and movement within the country. These returnees, the majority of them were well aware of the virus, but still most of them were afraid of transmitting the virus to others, especially to their family members when they get home. They obtain their information on the virus and how to protect themselves from the virus from different sources, mainly online community, government, and family and friends in Afghanistan and abroad. Our health professionals were reported as the most trusted source. Regarding protective measures, access to masks, sanitary items, and in case of catching the virus, some of the means taking these protective measures were more among those who are in returning camp, especially keeping social distance. Besides the returnees responsible, they reported some key barriers to access healthcare services in Afghanistan. The main ones were medical services, overwhelmed, and no health services in some of respondents' living area. Also, lack of knowledge about where to access health services and unclear advice around testing and treating coronavirus were cited as other main barriers to access the health services. Regarding the needs of returnees, almost all respondents reported that they had not received any additional assistance in the outbreak, and they stated that the need for extra support in the form of cash assistance, distribution of sanitary items, basic needs such as food, water, shelter, and access to health services. So there is a high amount of needs among returnees, which currently are not being met. In conclusion, Afghan returnees are extremely vulnerable to contracting and transmitting the virus during their long journey back to home, often with a lack of support from the government, from Afghanistan and host countries, especially those who are returning from Iran. Once they get to Afghanistan, they face with a situation which is no better. Most of them don't have job or income. They are also facing with this social stigma, which adds up to their psychological stress. I'm sure other speakers will talk about humanitarian responses later, but any intervention needs to consider all the health and psychological aspects in relation to COVID-19. Even likely to continue in the next months, will accommodate the of these vulnerable populations. I think my time is up, so I'm gonna stop here, but I'm happy to answer any question later. Ali, thank you.
Thank you very much. Thank you. Can I ask everyone, please mute yourself, especially those who are on with their mobile phones, so the speakers don't get a background noise. Thank you very much. Yeah, thank you, Mr. Mohammadi, for your excellent presentation. I think I have a few questions, but I would rather go directly to the questions from the some participants. Mr. Nasir Ahmad, he asked a question. He asked his question from Mr. Osman Sharifi. He says that you said there is the people don't trust in Kabul. They don't trust the virus. This is and the problem is the Afghan government officials, they do not observe the regulations. So how could you expect people to follow the regulations? And a very good example is the funeral ceremony of this university professor who was killed 2 days ago in Kabul, and today hundreds of people were attending in his funeral. And this is for you, Mr. Sharifi, and there's one question from Zargar. Maybe Mohammadi and Pakzad, you could answer this question. During COVID-19.
و در مورد COVID-19 عملیاتی انجام بدن برای
to SIA and gender-based violence, and probably you know, for the returnees from Iran. Maybe we start with these two questions. Dr. Osman, floor is yours.
Can you hear me now?
Yes, please.
That's an excellent question. Just before coming here, I talked to the Deputy Health Minister, Dr. Majro. He's in charge of like dealing with the problems, and he told me like the disbelief, the public disbelief in the virus and the seriousness of the illness is probably the single biggest factor in what has led to an explosion of the outbreak of the infection in Afghanistan. And to be honest, you know, we have to say like the Afghan government was wisely and quickly moved to lock down the cities when the first case of the virus was detected in Herat and then followed by Kabul and others. And there are a lot of, you know, there are a lot of campaigns here and there to inform the people about the seriousness of the illness. There were really serious efforts put by the government at initial stage to inform the government, inform the people, the public about how the virus can affect their lives and how deadly can it be. But and what as we observed, the people at the initial stages, like back in April and February, they did observe the lockdown and the quarantine, but it didn't last long, and there's a reason for that. I mean, when you're living in a population where more than half are living under the poverty line, and the people are just seriously and really and literally rely on their daily incomes to survive, to feed their families, they cannot really go with a strict lockdown. That's why, like after 2 weeks, we observed that the people started to get out and say like, we cannot continue with this. But then, as the question goes, there's also this thing, you know, when people started breaking the lockdown measures put in place. The government officials, some of them or most of them, also just try to ignore it. And today, as it's mentioned, we just observed today that there was a funeral ceremony of a senior cleric in Afghanistan and in Kabul, and there were literally like hundreds of thousands of people attending it. Like there was no social distancing, and they were not wearing masks, most of them. This is a serious problem that needs to be addressed. And that's something that's the real reason that we now witness a kind of hundreds of percents of increase in the infection rate in Afghanistan, and that's why the Afghan government, the health officials now think of a second phase of lockdown. Today, just before coming here, I went through the Facebook pages, and I saw like people were just like writing that the Afghan Facebook has now today turned into funeral pages, because there are hundreds of people, dozens of people every day announcing the deaths of people who has died from coronavirus, who are suspected to have died from coronavirus. And I think we're now at a stage now that the people are just starting to take serious the virus much more than before. And that's why the health officials are a little bit optimistic that this time, if they impose or announce a second phase of coronavirus lockdown, probably much more stricter than before, then the people, they're hopeful. That's the hope, that they'll observe it much more than before, because a lot of people are dying on a daily basis from coronavirus, and now the people are just seeing that it's a serious thing. It's not a joke. It's serious, and that's the hope. The hope is that if there's another round of lockdown, this time the people will take it serious and break the chain of the spread of the virus in the community.
Thank you, Mr. Sharifi. Ms. Pakzad, and could you be please brief, because we are running, out of time.
If the question, thank you so much, first of all, for the question. And if the question is about the services that we are providing for the needy women, for us, it is deportees women, single returnees, as well as women running away from a very, very difficult and domestic situation. So we, despite the lack of financial support, which I mentioned already, particularly in the time of crisis, our safe houses are open, and we are trying to offer the regular services such as psychosocial counseling, legal aid, and legal support. We are using in a different way. As I mentioned, we have the lack of staff, like the shortage of staff is one of the biggest problems that we are facing, but we are looking for some other solution and options that we replace with the mechanism that we already use, like instead of face-to-face counseling, to do not be so close in contact for safety of our staff, to be safe. We are looking for some kind of like new technology, and through a Skype, sort of a Skype call, or in 2 different rooms or more in open space, to provide the same services without any what you call delay in the support, because they are in need, and we cannot wait. If they are wait, it might, some things happen and they lose their life. So we try our best, and we're looking, as I mentioned, we are knocking the donor doors, that we can provide more laptops and computer for each of our staff, that they should stay in contact with the client. When the client coming to our FGCs, family guidance centers, we should provide them, because we cannot put the life of our staff at risk, which some of them already infected with the new arrival cases who are coming from Iran, has a deportees or has a single returnees. So we are really in a difficult situation. We cannot close the door of our shelter, but we cannot be careless about the safety of our staff and the rest of the clients who are in the service, who are in our shelter. We try our best, and hopefully we will get some support that we should continue in the same not the same regular basis, but in a new technology ways to minimize the risk and also provide the same services to our clients.
Thank you. Mr. Mohammadi, do you have an answer?
Sorry, Ali John. I was breaking off for a moment, so I couldn't get the question. If you could.
Okay, let me because we have so many questions now. I just go through some of the questions, and if you could just write them down, and then we'll go actually as a last round, because we are running out of time. Mr. Mir has mentioned that the lack of honesty in distributing the aid to the needy people in Herat and Kabul by the government, like I think he refers to more to a kind of corruption, and the lack of exact data and statistics about how many people have been infected in the country, how to cope with this lack of information and lack of statistics. Mustafa, how reliable and truthful? Mustafa is asking how reliable and truthful are the information and statistics that are being provided by the Afghan Ministry of Health. So this is the question. John Moore is asking a question: why Pakistan is still support ISIS to conduct attacks in Afghanistan? This is and then we have another question. Okay, sorry.
خب علل حساب اگر امکان داره محمود سال اول جواب بدم که در خصوص داده ها بود، داده های موثق.
First question, anyhow, if you permit me, of course, Afghanistan, the situation we have where we are faced with a lot of difficulty in Afghanistan. For example, we are lack of specifically that present situation, and it is adding to the death concerning the Corona-19. However, the only thing is that this for us exists is the international organization to help get from them. From government, we don't have that certainty to receive help from them. NGOs that are in the country, the only thing that I can think of, we have to talk to different institutions according to their ability to help us and have a coordination among and between these institutions and organization in a way that that through committees to work with each other, to coordinate with each other in order to render the services. We are trying our best. For example, last week we had 2 or 3 sessions with some organization concerning the COVID-19 and its effects on the society, and then the people that were without any shelter, any house, any home. We collect all those information, all those data, and even institutions that are in planning, in coordination to help us. We work together, but for the present time, what we have as personnel, staff, including governor, we don't see that. But the people and those who are affected by the COVID-19, and a lot of people think that the debt is more than what we have announced.
I may go just to read the last bit of question and then ask our
آخرین سوال ها را میخونم براتون. سوال اول این است.
Mawia Masumi says almost 71% of Afghanistan population live in rural areas with little healthcare, and mostly those who are under. So a lot of people live in the rural areas, under the in the areas where insurgents have to control. and government aid is concentrated in cities, and during this pandemic, it would lead to serious problems. What is the solution in that regard and role of international aid agencies? Matiullah asked that a few days ago, the Minister of Health was fired and a new minister came to the ministry. So does it have a negative impact on the spread of the virus? Then we have a question from Rahat Muslem. What are the main channels that the government uses to educate the country on COVID-19, and who are and how are the results? And then we have a question from John Moore again. During COVID-19, many attacks killed Afghans, and all these groups are supported by Pakistan. When Pakistan will stop funding these terrorist groups? And then Adil Ahmad, Adil Khan, could the disbelief of people could be a reason of the false promises regarding and corrupted that they now don't believe the government at all? Maybe I will take one more question. Osman Sharifi, Saeed Ahmad is asking from Osman Sharifi, most of Afghans are careless about COVID-19. So what Afghan government did about general awareness to Afghans about protection against COVID-19? So if you have time, I will take some more questions. So please, Osman and Pakzad and Mohammadi, please be brief in your answers. We have 5 minutes or 6 minutes more maximum.
Can I go first, please?
Yes, please.
Yeah. I mean, that's an excellent question. What can the Afghan government do now to contain the pandemic? To be honest, I have to say, it's now out of the government control. Afghan government's no longer in control of the situation. I've talked to many doctors over the past days and weeks, and I've gone to the hospitals. I've seen in most of the hospitals I went, like 60 to 70% of the health workers and doctors were either infected or were not present there because of the fear of the coronavirus. Officially, the data says that 400 Afghan doctors and health workers have been infected and 13 have died. But just in Herat province, yesterday, the director of the regional hospital announced that 600 doctors there had tested positive for the virus, and 300 more were waiting for the results. That's almost like 60% of the workforce that they have for the region. And most of them were not there. Afghan government is trying its best to do, but it's not able. In the face of the enormity of the challenges that it faced when it comes to fighting a pandemic, I think the Afghan government has lost it. For now, what we can do is we should count on not just the government, but also on the people to raise their awareness. But more than that, we need the international community, the aid agencies, to come to Afghanistan, to come to the aid of Afghanistan, to come to the aid of the health sector, to come to the aid of the government to save them. Otherwise, we will witness a humanitarian catastrophes. There are a lot of IDP camps in Kabul. I've been to some of them. They're very crowded and packed, with no or little access to basic health cares. And for most of them I talked, they were saying like quarantine and lockdown is not really a workable option for us. They were saying no movement for us means no food. And that means mass deaths. So they were saying like, if you want us to observe the lockdown, you should help us. You should provide us with food. And that's something I think the Afghan government cannot do. I think it's now for the international community, for the aid agencies, for everybody to come to the aid of Afghanistan. We're now we're just literally on the brink of a catastrophe. Today, everybody I call, just before coming here, people were just calling me and saying that me and my families are all ill, but we want to go to the hospital, the two main COVID-19 hospitals that we have in Kabul, but they're overwhelmed. There's no place for us. There are even patients lying outside the hospital. So what should we do at home? Just give us some advice, something. So that's why I think we're on the brink of really a catastrophe, and it's not just the Afghan government. We should call and we should count on aid and help from international community, from donors to come to the help of Afghanistan. Otherwise, despite the official low infection rate and count we have, the real infection is way higher and really catastrophic.
Do you want to, just for 20 seconds, the number of attacks happened in the last month recently during pandemic?
the number of attacks has decreased, but there are still from around 200-300 like the month before to around 6 per day. But the thing is, that's also because the Taliban have also been affected by the coronavirus. Today we had a report about how the coronavirus in Taliban areas have infected the people, but also the fighters. And there are also reports about international media that the Taliban leadership have been affected by the coronavirus itself. So in Taliban areas, it's really worse. I mean, yeah.
Thank you. Thank you. I will, Ms. Pakzad.
Yes, thank you, Dr. Ali. If I answer the question about the corruption, yeah, there is no doubt, and that is unfortunately the sad reality of Afghanistan, that most of the aid are not, distributing to the right people, and also it is not fully distributed. And we can see the reason why a huge number of the people, and mostly the Herat, 80% of the population, according to unconfirmed report, are infected with the virus, because the food, the support and the assistance is not enough, and also it is not distributed because of the corruption. So that's why people are just going to their businesses, to their work, and they have to decide between surviving and being healthy, because there is no support from the government. Actually, there is no mechanism, there is no system. Some information leaked on the Facebook that for COVID-19 budget, which was like the support of the international community, and also the money which Afghanistan government redirected from some other part of the budget for COVID-19, fighting COVID-19. And the information showed that they are spending money like 3 to 4 times higher than the real price. Like buying a bed, it was like 4 times higher than the real price in the market, or a kind of teapot. So it is clearly showed that the corruption is in a very high level from top to down. And I think the solution is that we should have a responsible citizen. Civil society should be involved. If I talk about Herat, there is 2 committees fighting for COVID-19. One is at the hospital level, and one is at the provincial level, which governor is the leading one at the provincial level, and in the hospital is leading by the head of the hospital. And none of those committees are women, representing their community, while half of the community are women. And there is no women, and there is not kind of trustable people that you can trust them. They are not contact, and they are not, reaching out the poor people. They are just distributing in some extent and giving to some community level. We are observing the dry bread distribution with a very low quality, and even they distribute the carts for giving 5 loaves of breads every day for the poor family. And some news come out that even those carts are distributed for the people having 4 or 5 cars coming every night to their house, and then they are still receiving that kind of support. So it is totally not only disasters because of the pandemic, because of the COVID-19, it is a disaster because people are losing their job, even the day paid labors, the normal job. People lost their job and they cannot survive. And we are afraid that so many tragedy is on the way. It's not about sicknesses. It is not only about COVID-19. It will be about the child marriage, about the forced marriage, about the, people will flee from one area to the other area to think if they can survive and give at least one-time food for their family. I'm really sad to share that story with you.
Thank you, Ms. Pakzad. I can give 30 seconds to Mohammadi just to say your final words. And unfortunately, we've just run out of time. Can you manage 30 seconds?
Yep, Ali. So there is no time. I just want to say something about the question on informing people regarding the virus. Just want to emphasize on the role of humanitarian organizations as well as diaspora organizations. Our data during last three years of data collection, our data always shows that one of the main information sources for Afghan migrants and refugees are always diaspora. Although regarding the sources of information on COVID-19, the main sources are online community, but I believe still diaspora can play a vital role here through sharing reliable information, because one of the main barriers, for example, about accessing to health services or the misinformation. However, through which mechanism this role can be improved is something that we have to discuss more. Thank you.
Thank you very much. Unfortunately, I have to end this conversation. I have received some excellent questions. Unfortunately, we cannot take all those questions, and we didn't have time to touch upon all those questions. But now, as that was a very good ending by Mohammadi, that he mentioned diaspora organizations, and then now I hand over the session to Adrian Bori, who is a project coordinator at Danish Refugee Council Diaspora Program, and he will take the lead in the second session, that what diaspora organizations can do. Adrian.
Thank you very much. It was a very interesting discussion, and it set a very dark scene for the situation in Afghanistan in regard to COVID-19. So it makes it even more important for the diaspora to support in any way they can. And now we will see a few examples of diaspora organizations being active in supporting, providing support in regard to the COVID-19 crisis. So we have 5 speakers. The first one, and please, I apologize in advance for pronunciation of the name. I'm sure it won't be correct. I hope you will still be able to recognize them. I'll read them in the order of the name in the program. So first we have Dr. Rahat Muslem from the KEIHAN Foundation in the Netherlands. Dr. Muslem is a medical doctor and chairman of the KEIHAN Foundation. And the KEIHAN Foundation is currently implementing a campaign to support medical staff in Afghanistan. The campaign is called Save Medics in Afghanistan, and we'll hear a bit more about that. The second speaker is Razma Paykardjoe from the Medical Committee Afghanistan, Netherlands. Razma is the chairwoman of the organization, and MCAN, as it is shortened, is a volunteering initiative consisting of multidisciplinary group of medical doctors and academics living in the Netherlands. So they'll be able to provide examples of support from the medical side as well. Then we have the speakers Homa Abbas. Homa works for the Afghanistan Frauenverein, the Afghan Women's Association in Germany. And at the moment, the association is organizing a corona relief emergency action for about 200 people in need in Raibi Baba refugee camp in Kabul. The next speaker is Mir Gusuddin and Kawa Musle from the Afghan Cultural Association in Austria. Mir is the president of the association, and Dr. Kawa Musle is the chairwoman of the women's department of the organization. And currently, the organization is conducting a support campaign for poor families in the corona pandemic in Afghanistan in cooperation with the Austrian NGO Jugend eine Welt. And finally, the last speaker is Ali Javad Eslamzadeh. Ali is the Iran focal point at the Asia Pacific Network of Refugees. It's shortened for APNOR. And Ali will talk about the recent global advocacy initiative, the Refugee Rise, and how they support COVID-19 in response from the region from a bit more of an advocacy and information point of view. So we have a very interesting panel here, and each of the person in the panel, now we are a bit short on time, but please try to keep it to 5 minutes, and then we'll take questions. If you have questions, please write them in the chats, either in English if possible or in Dari, and we'll take questions at the end of the session. Thank you. The first speaker is Dr. Hart. Are you here?
Yes, I'm here. Thank you very much. Thank you for introducing us. My name is Rahat Muslem. I'm not the current chairman of the KEIHAN Foundation. We have a new chairwoman, which is Dr. Niloufar Rahim, the current chairwoman of the KEIHAN Foundation. I will shortly introduce our foundation and touch upon the current projects that we have running regarding COVID-19 in Afghanistan. But first of all, thank you again very much for the VIDC and the DRC for organizing this session. It was very informative, also regarding the current update on the COVID situation in Afghanistan. We see the news and we get information from our local staff there in Afghanistan, but still it's good to hear a nationwide update. And sad to hear that even in these times that we think as men we have a hard time, but even the women have always the worst time. And it's sad to hear that they experience more violence during this period, during these hard times. The KEIHAN Foundation is the Dutch Afghan Foundation, over 50 years existing in the Netherlands, one of the largest organizations focusing on 3 pillars. First of all, it's education. We have several projects running in Afghanistan, for example, clinical skills, which focus on educating doctors, training them in medical skills that they can use in practice. Research for Life, which focuses on providing education regarding scientific research and training Afghan academics to practice scientific research and quantify the problems and work on solutions. The several other things that we do is the integration in the Netherlands, which we provide evenings, information evenings, etc. And the third thing is humanitarian support, and which one of the projects includes the COVID-19 support project that we've doing. And we started with Save Our Medics, which focuses on providing personal protection kits to PPE to healthcare workers in regions that they're scarce. We heard that there were several hospitals where COVID-19 patients were admitted, but they didn't have any personal protective gear. And so instead of waiting for the governmental support, which is started now, but back in 1 or 2 months ago, wasn't active yet, what we did was we introduced, we gathered money here in the Netherlands, and then we had our local members in Afghanistan buy personal protective gear and make several packages, including all the 7 protective gears that you need, like a mask, a scarf, jacket, etc., including pulse oximetry to measure the saturation or hypoxia in patients, and provide them to several hospitals. So we have pictures, etc., is on our website. But what we did is we made several packages, including over 100, 200 personal protective gears, and then distributed them in several hospitals, including in Herat, where we now work together with the WHO, who provides the transportation of these packages that we make. And now currently we've provided over a dozen hospitals and over 2,000 doctors we've assisted in having these protective gears. And my question was regarding education, because currently we're working on an education program as there is no treatment for COVID-19. And the only thing you can really do to prevent an outburst, as was said previously, that this will be a humanitarian disaster if there's not a good prevention method in Afghanistan. And we're working now on education, an education program focusing on the rural area, because in the major cities, the government provides a lot of information and people are getting more aware of the situation and learn about how to prevent infection spread. But in rural areas, as the majority of the country lives in rural areas, 71%, if you could provide them with the right information and the tools, you would prevent super infection spread there. And they could learn how to work with the coronavirus in the society and still be able to go to work, provide their families, and yet stop or prevent the spread of the infection. That's one of the projects that we're currently working on. And I'm happy to, I'll keep it short now, but I'll be happy to answer questions if you have any other questions for us.
Thank you very much. That was very, very interesting. And definitely medical equipment is something that is for sure in high need. So that was a very interesting example. Now we'll listen to another example from the medical side with Razma Paykardjoe. Razma, are you here?
Yes, thank you. I had to unmute myself. First of all, thank you very much for inviting me to this event. I would start with a short introduction. I'm Razma Paykardjoe. And if I say Dindari, Razma, Paykardjoe. And I'm the chair of MCAN, which stands for Medical Committee Afghanistan Netherlands. We are based here in the Netherlands, consistent of doctors here in the Netherlands working on a volunteering basis. We focus mainly on knowledge sharing. So we have projects which we create for mostly for higher education, and particularly in medical universities and hospitals. We have projects such as Up to Date, which is now on hold, which focuses mainly on current, actually it's a program where doctors can look for clinical information, up-to-date information, which is updates itself every now and then, and makes actually books unnecessary. So we have that project. Another project we have is a surgical education, which provides doctors, especially the surgeons in training, and also other senior surgeons, guidelines from the start of the operation till after care of the operation. It has images, it has videos, how to operate in surgery. We have that project, and we have more projects to come, but now we are on hold because of the coronavirus. Moreover, now concerning the COVID, we have started, I think it was start of April, by gathering all the medical specialists here in the Netherlands, asking them to come and share their experience and knowledge with us. And we did that by also asking the doctors in Afghanistan. And we reached a lot of doctors in Afghanistan, from Herat province to Farah, to Badakhshan, to Darikundi, to Nangarhar, and so on. So we reached a lot of provinces, and a lot of doctors participated in our brainstorm. And what we came to know is that there is a lack of guideline there for medical staff. And moreover, they have they don't have much of, as my colleague, as we heard it in the first session, there's so many shortage in every area in the medical sector. So what we did is we started with webinars, and we had in total we had every week webinars of which covered almost every part of the COVID-19 section. So we started with the prevention of COVID-19 till the diagnostics, the treatment, and we ended with the pathophysiology of COVID-19, and up to and we had doctors from actually all the provinces in Afghanistan who participated in our webinars. And those webinars are also online, and we shared it with all the participants and asked them to spread it also to other colleagues so that they can watch it again. And we are now also busy with the guideline is almost finished. So we hope to hand it over this week or next week to the Ministry of Public Health. We tried to have a contact earlier with the Ministry of Public Health. Unfortunately, we're not able to get in touch. But yesterday, luckily, we had a meeting online, and we spoke to them. So we hope actually that they can help us further with contacting the doctors who are also involved in COVID-19, and to reach actually the actual doctors. What I would also like to mention is my colleague Paris Kohistani is also here is also participating. So if there is a questions, we can both answer it. So that was it. Let me keep it short.
Thank you very much. That was very interesting. So in the first presentation, we had the equipment, and now we have the knowledge sharing. And also supporting developing guidelines. So I think that's showing already some different kind of activities that the diaspora can support with. Now we'll move on to Homa Abbas. Homa, are you here? So during the during the first session, we discussed about the special needs of women in a situation of pandemic, and also the very difficult situation in refugee camps. So here, oh, great, with a picture as well. Now we'll hear some more on that.
Yes. The first thing we did when we heard, first of all, my name is Homa Abbas. I am from Afghan Volunteer Women's Organization in Afghanistan, in Germany, Afghanistan Foundation, and we have some different projects such as like schools, tailoring schools, and clinics, and some special helps for children, especially for girls. So what we did concerning the COVID-19 was to make these banners, as you can see, through pictures everyone should see. It's not only for children, for everyone to see, like not to as a prevention, not to get in contact with people, not to get too close to each other, no kissing, hugging, wash your hands, and so on and so on. This one we did, like we finished, this was one of our member, Simin John Haider Fazal. It was at the end of April, and beginning of May, we started with this campaign to send it to these 4 provinces, or 3 provinces that we are active in, like Kunduz, Ghazni, and Shakardara by Kabul. Next to that, we have started some more campaigns of giving food, like food stuff, like such as flour, oil, rice, kidney beans, and so on, and tea, because Afghans are very much keen to have some good tea. And in Ramadan, we knew that people are very poor and they need some food. So we distributed food for, where was it? 1 second. Yeah, this was for our staff. There are like 64 teachers and colleagues in Kunduz and in Safa School. Safa School is also one of the newest schools that is not officially open because of the coronavirus, but we have like the students are there, and we're giving them all the stuff that they need. So we have started this campaign with distributing food and hygiene materials to spend the Ramadan month, like the fasting month of Ramadan, plus dates and some other stuff. We have not given up with the coronavirus. Like we have been active. It was a time that we stopped, for example, digging the wells, which is one of the biggest projects. We have 640 wells that we have digged. We have stopped it for a short time, but now, right now, at the moment, we are working on 20 more to dig in Kunduz. Some of them are in Ghazni and Kabul, but mostly in Kunduz because we have people to take care of to maintain them. Water is one of the most important things that we have started now. We have gathered some good money, thank God, for COVID-19. And we haven't started the distribution of the hygiene kits, which will be distributed, I think, in 2 weeks. We have to buy all the things, and this would be a water tank, hygiene kit like masks and soaps and all these things, which belongs to the hygiene. Plus also the distribution of food again. We have distributed food in all our schools. So that means the last one that you said 200, it was 2,000, Ms. Pori. This was 2,000 people in Ghaibi Baba camp. This is by Kabul. We have distributed already. The distribution is finished. It was very successful and people are very happy. We distributed food, as I said, these things like flour and oil and rice. And we are about to distribute the hygiene kits, which will be which will be in 2 weeks' time. And this is the money we gathered. And if I may make an appeal, like aid appeal, to support us, because we still need some more money to also provide them with more food, because when we give them the hygiene kits, I'm sure they would say, like, we'd rather have something to eat. So we would love to hear from each one of you and by supporting us. And the distribution of the food, and before I forget, is not only by us, but also by, with the help of Visions for Children.
Thank you very much. Again, another great example of diaspora mobilizing and providing support, doing visuals to showcase how to behave in the time of a pandemic, providing food, providing equipment, etc. So that's a lot of really good example. So we'll move on to the next speaker, Mia Kusudin and Kawa Musle.
Yeah, hello everyone.
Hello, we can hear you.
Okay, hello everyone. This is Gauhar Musleh, and I'm the head of the Afghan Cultural Association in Vienna, the head of the women department, and also we have here today with us Mr. Ghausuddin Mir, the chairperson of the association as well. I was prepared to talk in English about our activities during the COVID-19 in Afghanistan, especially. But since there is interpretations available in both languages, I think also he is here present. So I'll hand over to him to talk more about our activities in Afghanistan. آقای میر هستین؟
تشکر گوا جان. سلام خدمت همه عزیزان. استود ملت شما فارسی دیدن. ما تشکر میکنم از جناب میخائیل فریزادی عزیز و از جناب ادریان بوری و همچنان خانم مهدس و دکتر سیواری صافی که ما را شامل از این پروگرام ساختن. دقیقاً یک کانون فرهنگ افغانستان در اتریش یکی از فعالترین انجمن‌ها است که کارهای خود در وقت زمانش در هر حالت تنظیم کرده و پروژه‌ای که ما داریم در سال 2004 به این طرف در افغانستان کوشش می‌کنیم که اطفال بی وضاحت و اطفال یتیم کوشش کمک کنیم که اونا به مکاتب برن و لوازم مقرطاسی با لوازم دیگه براشون که نیاز باشه، حتی به مکاتب بی سروری سنگری و مکتب بی هوا در خیرخانه دو مکتب همراه 500 فامیلی تحت قیمت ماست. گاهی براشون سالانه برای ارزش کمک میکنیم برای اطفالشون.
Excuse me, just 1 second. We have a problem with the interpretation. Can you just wait 1 second? We're just waiting for the interpretation to. Okay. I think they're switching team. When the interpretation is ready, could you say it in the channel that you are ready to do the interpretation? Yes. Yes. We can start again. Sorry about the interruption.
Can't problem. ما یک در مواخر روزای نخستین روزایی که
some of the first months that the corona starts, not only in Afghanistan but other places, we have started a project that's called the World of the Youth, which means that we had some food such as rice and beans, tea, sugar, some of the things that a family would need for a week or a month. We actually distributed that. Also, we have tried to give them masks and gloves for the families that couldn't afford it, and those people who are in the streets and they live in the streets and they were people who were not aware of it. We have been able to distribute some of the stuff to. Also, we had some programs as some of the television program in order to give awareness to people about the quarantine. We also have shared that information. We know that Afghanistan is a sort of a country where the powerful people will take all the advantages that they can. That they will take over some of the health services at their own service for their own families. That we need to provide some of the help directly to people of Afghanistan. So our help is for the poor families and the poor children to be directed to them. When it comes to Corona, that we have tried to work and give awareness to the refugee camps in Vienna on how to prevent the virus, especially those people who didn't know, they weren't aware of the rules that were there, especially our young people, refugees in Vienna, was charged because they were not aware and they didn't know what the rules were. We also have given awareness both in Pashto and Dari and also in German language. We have provided that, and thank God that we have access to Nangarhar, Kabul, and some of the northern parts, Logar, Jalalabad, and Bamyan, that we could reach our people in time, especially for those who are the most needy. I would like to thank you. I want to tell Mr. Adrian Bori that they actually included Germany and Holland in this. I asked him, why didn't you include Austria? And he said, we just didn't have the budget. But we are there. We are a foundation that we don't have connection to powerful people. And we're not involved in political process. We're just volunteer. All of our people are volunteer. We help from our own pocket. So if it's possible that we could be included, I am on the side of Denmark and Germany, but Austria should also be involved. And I'm hoping that in future we could be included on this project as well. Thank you very much.
Thank you very much for your presentation. I think it has. Sorry, I just have to remove the translation, otherwise I can hear myself being translated in Dari. Thank you very much for the translation. Because of the interpretation not starting, so very sorry about that. But it was very interesting to hear your work and the contribution that you're doing and how difficult it is to provide, food and all what the people, the poor people that are in even worse situation due to the pandemic and the measures that people have to take and the incapacity to have access to even a minimum of money and food. So it's providing a very important support. Now we will move to the last speaker, and or maybe before that, let me just get back to the question that you asked directly to me, and then after the next speaker, we'll take the questions from the group. You mentioned that you would like Austria to also be included in some of our projects, and we hope to be able to program on a more broadened level moving forward. It's not the case yet. Now we do often other projects in Denmark or project on a few countries based on the size of the funds that we can have from the donors. We hope that moving forward we'll be able to do a bit more projects that are open to all diaspora organizations based in Europe. That will be the aim, but we're not there yet. But we hear you. We hear you. So the next speaker is Ali Shavad Eslamzadeh. Ali. Are you here? So I've asked to unmute you. You are muted, so we cannot hear you. Oh, it seems like you are still driving. So I suggest to start questions, and we'll hear from you later when you can stop and talk. So let me take the first question. 1 second. There has been a thread in the chat regarding some patient being received at the hospital and treated for typhus. Uncertainty if this is actually coronavirus. So maybe one of the doctor could say something about that. If there has been cases of patients being received and indicated as not being COVID, while there's a lot of suspicion that it is actually COVID. Dr. Rahat, do you know something about that?
What we experience from our point of view regarding the care in Afghanistan is that either a lot of doctors don't dare to go to the hospitals anymore or the nurses don't dare to go anymore to the hospitals due to the coronavirus because they don't have any protective gear. Or that the ones who are there get infected. So I could assume that doctors will say that it is another diagnosis, either because they don't recognize that it's a COVID infection, because it does look like and several other diagnoses, or they'll say it's something else, so that nurses will continue to work at the hospitals. And hopefully they'll use the right equipment so that they won't get infected by themselves.
Thank you very much. We have another question, which is, what should be done to reach the villages and remote areas because of security? How to fight the taboo associated with the COVID-19? And I think that's a very important question that people might not be not dare going to the hospital. And let me maybe ask it to one of the other panelists, just to shift a bit. Maybe we could have Homa to say a few words on that, if this is okay. Homa Abbas, are you still online?
Yes, I'm there.
Yeah.
What was the question?
So the question is that there's a problem of reaching out to villages, so outside of the cities, and then there's a question of the taboo of people having symptoms and not daring saying it or going to the hospital. How do you, in terms of communication, how can you handle those things?
Okay. Yeah, we have a team of 12 people. Unfortunately, most of them are right now with the COVID-19 sick with that. But they still work. They are saying like we have all these symptoms and we really shiver, but we don't want to give up. But they do go to these villages or the camps. We don't go to the, yeah, we do. We do, because Qola, one of the villages, this is a very, very deserted village in the north side of Afghanistan, of Kabul, and there is like really, it's very difficult to reach there. But we have there a doctor, and he says that he's really very, very busy with the patients coming to him and complaining about all these symptoms. He himself, thank God, is healthy right now, and I mean, how to do it? We just do it, you know. I cannot recommend anything else to say like just do it. Take the protection, put these masks and wash your hands and no contacts. But then go and help the people. I mean, we wanted to go to Afghanistan. The only thing we were afraid of not going is to stuck there and then not being able to come back. And not being able to bring help as much as possible.
Thank you very much.
If I could include on that one note.
Yeah, please.
I think this, in time of great despair, it would be a great opportunity to work together with people who know who are familiar with the ways to the rural areas in Afghanistan. And due to this pandemic, it would be, I think, more safer because of the certain areas that were unsafe. Now, these people also have to take precautions, and that this would be an opportunity to access these rural areas where we wouldn't go before. And the best way would be by either contacting the people who are there and asking what their needs are, or or be in touch with people who know the ways there through the government or through other organizations who are currently active in those areas, and together be able to provide them with either education or food or protective gear in order to prevent them from having a small pandemic in those rural areas. Important is not to take the virus with you to them, because then you would introduce a problem.
Thank you very much. A question that is very related, and it's a question for diaspora organizations or in the panel, and let me know in the panel who would like to take it first. But we have, the question is, how do you as diaspora get information of what is happening on the ground, on the local level, also taking into account the difficulty of traveling and being able to move to this area? So how do you keep updated? Who would want to start? Maybe we can take two or three examples if we go rapidly.
Can I?
Please go ahead. Yeah.
Yeah, Homer?
Yes.
Yeah. Okay. Yeah. Our schools have started like we had a short stop for everything, but then we have started the schools, and we have everywhere we have a person who can take care of the schools and of our projects. So what we do, the schools are, of course, everything is with the post. Since Afghanistan is a poor country, we cannot provide them all with the laptops or internet. So we are sending our teachers, for example, make all the learning material as questions and answers, and they send them to the students, and the students send them back to them. And this way, and then there is a director of the school. So we ask the director to take care of that, and then they will report to us. The same with the wells. The wells, we have a person to take care of that. So if we have people, like only one person, to ask local, and then let the organization know here, then we know that if we can go on or not.
Thank you. Thank you very much. I think we had Mia who wanted to say something. Mia, are you online? Do you want to comment on this question as well? Anybody else interested to comment on the question? Otherwise, we'll move to the next one. So
we have local members who are working currently in Kabul, and we asked them to provide us with information, and they are in touch with the government and the local people. So if there is a need by other organizations in this session for information regarding the current situation in Afghanistan, they will be happy to share this information with them.
Okay, thank you very much. So I think that's
If you could permit me, we have our people in Afghanistan that are working with us. Every year I go for 2 months. This year as well, if I could fly out there, I would like to go there. We have one of the schools for BBAWA for the children that are in the street. We have our own people that are working voluntarily. There's an organization by the World of the Youth World that are working with us, and also there is another program in Austria. There's also a magazine that's called Bono in Europe. They are also cooperating with us. We also have a conference in Austria that hopefully Ms. Pakzad is also invited to be included. Most of the work that we do are voluntarily, and the information that we bring in, it comes from our own people that are cooperating with us, that are bringing us the information, and then from here we try to do work. I don't want to send it through an organization or NGO, because my experience has been that most of the money gets lost, that actually gets lost in the middle. So I personally want to go there, and I would distribute the money, or either have some of the people that are working with me that will distribute the funds to people.
Thank you very much. Please do.
The question is whether how to actually progress actually your actually how to carry on with the projects being so while you're not able to travel to Afghanistan. Was that the question?
It's also, how do you get information? How do you find out where are the needs if you cannot travel or access the location?
Well,
or if your local partners cannot even move, and travel.
Well, we had since we have been in Afghanistan, and myself also several times in Afghanistan, and also at different hospitals. So we have our contacts there, and actually we keep in touch every now and then, just to also evaluate our projects, but also ask them for new information, whether there is a need for other projects. So we got our information mostly from our partners, and actually mostly from the doctors we knew there, and also we have doctors who actually managed to get together all the doctors from different provinces through social media, and eventually we got really in contact with the head of the hospital in Herat, which was actually the worst where the pandemic started there in Afghanistan. So we get our information mostly through our colleagues in Afghanistan, the doctors there.
Thank you very much. There is another questions about how to ensure that there's no duplication between the work of happening on the ground and the work of NGOs and the diaspora. I think it's I can answer from the DSC point of view that locally there is some coordination between NGOs and also local NGOs with the government. So there is a level of coordination that allows for ensuring that at least large projects are not duplicating national efforts. But from the diaspora side, that would be interesting for me to hear when you are doing your project. For instance, if you're delivering PPE equipment, or if you are doing providing food in camps, are you coordinating those activities with local actors, government, or even international coordination body like OCHAs, or is it something that is done on more directly? Do you have any level of coordination with the project the support that you are provided? Any example, maybe to start, any example of coordination?
Try and
please go ahead if you want. Yeah.
I think it was a good example that there was an event in December in Vienna. There were a lot of diaspora organizations participating. I think that was a good initiative. And what concerns MCAN, we mostly have tight contact with KEIHAN Foundation, so that we don't do the same work. So also with the whole COVID-19 work, I contact the chairwoman of KEIHAN just to be able to help each other on that, and which we managed to kind of have separate projects, and we are helping each other on that. Other than that, I think it would be a great idea if the Afghan public health, so the ministry has some kind of overall overall system or something that help us with that, because in Europe you kind of it's already a big part, and if we also look at the United States or other countries, it would be really it's a lot of work to check that before you start a project. Yeah. Unless the local institutions tell us that they have already that project, then obviously we won't start it.
Fantastic. So coordination within the diaspora organization and also informing on the ground. Any other input from for the other diaspora initiatives? Are you coordinating internally, and are you coordinating on the ground?
Can I? Yep. What we have from the government is only the permission. The only time that they could help us was when we went to the Ministry of Refugees, and we wanted to help the camps with medication, and my daughter wanted to go and make some examination, like checkups, and I, as a physiotherapist, was also there. So they gave us a nurse, a pharmacist, and a car and a bed to do the examination, which was really nice of them. But other than that, for the distribution of the food, they would just the only thing was that it took a long time to get the permission, and especially in this corona time, to get the permission, because they would say like it's not safe and all these things. But through connections we could get the permission, and then but the only support we had was of course Visions for Children. Every time when we distribute the food, they are with us.
Okay, fantastic, thank you. I think we have time for one or two more comments if the other actors want to comment on this one.
We had a recent meeting with the Ministry of Public Health, and I think that this would be one of the best opportunities that we have as a diaspora organization to be taken serious by the government in Afghanistan, due to the desperate need of expert advice on this matter, support by the diaspora organization or international organizations, and guidance in this project, in this pandemic. And we discussed our projects with them and what we have in mind to do in the next couple of periods, and who we work together with. And I think also for the other diaspora organizations, that if they would like to work together with the Ministry of Public Health and to have a larger impact, or to work with other international organizations, for example, WHO support us in distributing our personal protection kits into several provinces in Afghanistan, because they have the transportation tools and means, that this would be the great time to work together with the international organizations and the Afghan government in order to have a larger impact.
Fantastic. One last comment, otherwise, because we're reaching the end of the event, so no more comments, then I will pass over to Mikael for some last words. Mikael, are you?
Yeah, I'm here.
Perfect.
So thank you, Adrian. Wait a second. No, everything fine. So thank you very much to all the speakers, and thank you very much to the participants for listening and raising all the important questions. I know this is just a start. It's not a solution to discuss these issues on an online seminar or webinar, but we thought that it makes sense to bridge the diaspora organizations with people in Afghanistan, with experts and interested public here in Denmark, Austria, in other countries. I know from the registration that a lot of medical staff from Afghanistan has joined the meeting today. Therefore, I suggest that if you don't mind, that we will share email addresses after by tomorrow, so that the diaspora organization can be in touch with the medical staff in Afghanistan directly, so that they can exchange and work on overcoming this difficult situation, which faces, of course, all of us and all of the countries in the world. But for a poor country like Afghanistan, it's getting more and more difficult to overcome the pandemic. second follow-up is, of course, that the Danish Refugee Council and we in VIDC, we do our best to support the diaspora organizations in Europe, so to make them, or let's say that they get heard by the general public, also by the donor organizations, because there's not enough support. What we can learn from the pandemic and the reaction of the diaspora organizations is that they are very fast in doing something, in supporting the people on the ground in Afghanistan. And I think this support should be supported by donors also, which is not that easy. And neither the VIDC nor the DRC are donor organizations, but we can try to help and to lobby. Finally, it's our duty to inform the general public in Europe. I think there's a danger that Afghanistan is only on news when there's a big Taliban attack, or if there are negotiations between the US and the Taliban, but there's not much information about what's going on in the country. So it's our duty and the duty of the diaspora organizations as well to inform the public in our countries and what's going on in Afghanistan. And for you guys in Afghanistan, it's very important for us to get your views, to get knowledge. And I think you are the best people to inform us about what you need and what is needed and what kind of support is needed. Therefore, such a seminar is only a start, and we do our best to follow it up. Adrian, is there something you want to add?
Yeah, no, I mean, I wanted to second what you're saying, that this is an opportunity to get to know each other, to start a discussion. And we hope as DRC, and we're very pleased to be able to work with VIDC to continue creating opportunities for Afghan diaspora to meet and exchange and collaborate. So that's something that we'll continue doing, and hopefully we'll be able to do it on a larger scale. So not with project in one or two countries, but projects that are open to all of you. That's the hope.
So then, again, thank you. I will close the meeting. Please be in touch with us. You have our email addresses. At least those who have registered to the DRC, the email address of DRC, and those who have registered to VIDC can be in direct contact with me. I'm pleased to be in contact with you, and I wish you a good evening in Afghanistan, a good evening here in Europe. Bye-bye.
Bye-bye. Thank you very much.
Bye-bye.
Just wanted to say that I'm one of the survivors of coronavirus. I haven't.
Oh.
And the only thing we can do is to ask people, like I could not ask people because I was one of them. But you guys, if you could ask people and ask them what they did to survive, and then somehow send it via WhatsApp or Facebook or other medias to the people who don't know anything about coronavirus. That would be my recommendation.
Thank you, Oma.
I did a lot, like I interviewed with many TV stations, and I made a video record and sent it to everyone, so to know that it's not killing, not necessarily.
Thank you.
I just wanted to also thank you, everyone. My name is Asya. I'm sort of connecting through in London.
Hi, Asya.
Sorry, I'm actually hearing an echo. Just hold on, please. Yeah, sorry. Yeah, unfortunately, my connection is funny. It's just fuzzy, and then it comes and goes. Anyway, I'm connecting to you from London, and I just also wanted to say a big thank you to Adrian and Michael for organizing this. Of course, it's very difficult to cope even for yourself and manage your own life, but I think everyone in this panel and today's seminar or conference is eager to do some positive work for Afghanistan. And that is in itself, it's a kind of rewarding sort of, it's reassuring that everyone wants to help. And I just wanted to say a big thank you to everyone. On that note, I'm proud to say that we have also started various different projects here in the UK, providing information and so on through website and social media as much as possible. On the note about to support the mental status of the Afghan communities here and so on, we started an online exhibition. If anyone wants to collaborate or send submissions, it would be great, because we have also started a peace conference and a peace festival online. So anyone who would like to participate or submit any kind of work, I would appreciate if you can let us know. This is in support to ensure that we actually follow the peace process of what's happening in Afghanistan amidst COVID-19. So we need to not only remember to feed or to deal with the health side, but the mental status and the health condition of the people and their minds and the well-being of them functioning as, in a normal way. Requires to create also platforms such as an online discussion and dialogue about what is going on. So I am pleased to announce that we have actually started that process of collecting the submissions, and the program will be actually happening online until we actually find an opportunity to have a physical conference, hopefully towards the end of the year or maybe next year. We'll see. But an online activity has started. Besides that, I'm also very proud to announce that in the UK, about 35 or more organizations have come together, and we have actually started a joint appeal to raise £1 million for Afghanistan. So already there's a lot of activity going on social media and amongst ourselves, organizing into committees to promote the activities. So if any of the organizations are eager to find out more, please contact us. There are various different sort of initiatives which will promote your work as well as the work, and we all work for the same cause. It's Afghanistan, and that is needs to be remembered.
Sorry.
Thank you. I just wanted to.
No, but you should inform us about your website. Please type the website in the chat so that the people can follow your initiative. Otherwise, we can't find you.
Yeah. All right. Yeah, the website is. Yeah, definitely. I will type it. It's actually www.afghanacademy.org.uk, and you will find the most recent projects which are linked to COVID-19 and the crisis currently is actually advertised there. And we are in the process of sort of, getting more submissions as well as activities in the process. So yeah, by all means, please, anyone who could support with any area, please contact us. Thank you.
Thank you.
Thank you. So I will close the meeting now. Thank you all.
Thank you all.